So I just want to say good morning to you and thank you for being a part of EOB's Breast Cancer Week. We really appreciate it. And today's talk is about better breast health, what we can do to become better educated about breast cancer and just our own breast, because it's easy to think of like, I don't feel anything. I don't feel bad, but it's not always that simple. So thank you for joining us, Dr. Lisa Thompson. Could you just give us a little brief introduction of yourself?
Sure. Thanks for having me. My name is Dr. Lisa Thompson. I am board certified in emergency medicine and also hospice and palliative medicine. I've practiced medicine for a little over 25 years now. I've also done telemedicine for several years, and for the last few years, I've been working as a medical director with Anthem Nevada Medicaid.
Great, thank you so much. So let's start off with, on Friday, we're going to be having the Mammorama event and the Mammo Van at the MLK Junior Senior Center all day. So let's start off with how important mammograms are.
Well, mammograms are super important. Basically, if you have breasts, you have the risk of getting breast cancer. And the important thing about that is sometimes we have lumps and bumps in our breasts that are normal and that we can actually feel with our fingers. But we can only feel things in our breasts that are at least the size of a lima bean. So that means if you have a cancer that's starting to grow in your breast that's much smaller than that, you can't really detect that, by looking at your breast or feeling them with your fingers. A mammogram, on the other hand, can pick up cancer when it's super tiny and super early, which means that it's easier to treat and you're less likely to die from breast cancer. In fact, mammograms save lives because they reduce the chance of you dying from breast cancer by up to 40% in some cases. So mammograms are lifesavers that are important tools to have in our toolboxes to make sure that we're taking care of ourselves and that we can decrease our risk of dying from breast cancer.
Yeah, and I know a lot of times it's like, well, I go get my yearly physical, I go to my OBGYN for my yearly, and they do a breast exam, but it's really not enough when you consider the mammogram benefits.
That's right. Now, it is really important, and it's great if you are doing your regular annual physical exams where your doctor can examine your breasts, and that you're doing your own breast self-exams at least once a month so that you're familiar with what I call the neighborhoods of your breasts. You know what your breasts look like and feel like, and if there's some new visitor to the neighborhood, that's an indicator that you need to get with your doctor and you need some additional tests. And like I said, those are just tools in the toolbox, and getting your regular mammogram in addition to that helps keep track of what your breasts look like, what's normal for you, and can detect something early and small if it's not normal for you.
Yeah, and I know a lot of people really put off mammograms because cancer screenings are never fun and they're stressful, but the mammogram is not going to be you're not going to get diagnosed with a breast cancer right off a mammogram, right? How is breast cancer diagnosed?
You're right. So the mammogram itself is a tool, like I said, that can help identify something that may be suspicious, that may not look like the normal breast tissue that should be there. And then that would trigger a set of other tests that the radiologist would do to get a closer look at that sort of abnormal or suspicious looking area, like an ultrasound or another type of mammogram or an MRI. And then if there's still suspicion that that area is not quite right, then your doctor would recommend that you get a biopsy, which could mean just putting a needle in that suspicious area and getting some fluid or a small specimen and sending that off to the lab for pathology, or actually removing it if it's a small enough lump and sending that to the lab for pathology. The pathology lab report is the definitive diagnosis if it is cancer or not. So, the mammogram, even though it's a really good test and it's good at picking up on cancers, it's not the definitive test for finding cancer. I always use the analogy, and this helps me understand also why it's important to stay on top of this. that your boobs are sort of like a loaf of raisin bread, which I'm not a real big fan of raisins, so I like to think of a banana loaf with chocolate chips.
I like
And
that
let's
better too.
so let's say someone said, okay, find all the chocolate chips in that loaf just using your fingers. If you do that, you may find some chocolate chips, but you're not going to find all the chocolate chips in that loaf. But if you were able to do a mammogram, that mammogram takes x-ray pictures and cuts them into slices so that you're less likely to miss those chocolate chips. And then if there's something abnormal about those chocolate chips, then they would be able to see that on that picture and say, okay, we need to do some additional pictures. And if we're really still suspicious, we need to take one of those and send it to the lab and find out is that cancer or not.
Yeah, that's great comparison because I know a lot of people fear mammograms. They're like, I don't want to have the bad news from it, but it isn't just bad news. It's just keeping on top of your health and being able to have kind of a baseline and be able to monitor. So no excuse not
Exactly.
to go get a mammogram. So what is the most common type of breast cancer diagnosis?
The most common type is called invasive ductal carcinoma. So that's a very fancy, expensive way of saying that there's a tumor, and carcinoma basically means tumor, that comes from cells that are from the milk ducts in your breast. So your breast tissue is made up of milk ducts and glands, and also fat and some other fibrous connective tissue. And this particular cancer that makes up about 80% of breast cancer diagnoses comes from those cells that are in the milk ducts in the breast tissue. And the reason they call it invasive is because this particular tumor or these types of cancer cells like to spread to other tissues and other parts of the body. Another common type besides that is called ductal carcinoma in situ. So again, those are tumor or cancer cells that come from the milk ducts in your breast. But in this case, they like to stay put. They don't usually spread. That's why they call it in situ. And this type of cancer, sometimes they call it stage 0 because it doesn't go anywhere and it's very easy to treat. But the problem is, since it likes to stay put, it often will come back even after treatment. But more common than that is the first type of cancer I described.
Gotcha. And you mentioned earlier of like we all, we might feel a lump and it's not necessarily anything cancerous or anything bad. And it's easy to jump to conclusions. If you
Hmm.
do find something that kind of seems unnormal for your normal breast, of what should you do next? What should be the next steps be?
The very first thing to do is don't panic, because the vast majority of lumps and bumps in your breast are completely normal and not cancer. That's why it's super important to do your regular breast exam so that you're familiar with who's in your neighborhoods of your breast. And then you can be familiar with when something unusual shows up. We all have, especially at different points in our menstrual cycle and at different points in our lives, lumps and bumps in our breasts. That's just normal. So don't panic if you find something. And your second step is to call your PCP. Your PCP will take it from there. They will examine you. They will make sure that you get the appropriate imaging study. So if you haven't had a mammogram, they're going to make sure that you get one. If you've already had one, they may want you to get another one or a different type of mammogram. They may want you to get an ultrasound. And then, like we were talking about before, if there's still something suspicious when they do this additional testing, they may want you to get a biopsy. But don't panic and talk to your doctor and let them take it from there.
Yeah, because you're speaking to somebody who is the constant Googler, and then I get on WebMD and I get into a black hole. And my mom now
Right.
knows this. She's like, get off Google. I'm like, but I can't. I need to see. So yeah, that would be me.
Yeah. Yeah.
But finding any lumps and bumps, I mean, this isn't just for somebody who is 50 and up for mammogram kind of age. Even if you're younger, you can still find it. So you still may be able to get a mammogram if you do find something that a doctor feels like they need to see closer, right? It's not just for a certain age and up.
Totally. Totally. So, they recommend that you start getting your first mammogram at the age of 40 and you get it every year after that. But if you're considered high risk, or if you find something unusual on your exam, even if you're 20 or 25 or 30, you're going to get a mammogram to make sure that everything is okay. So yeah, that's why you got to leave it up to your doctor if you find something, because those rules that we hear about when you're supposed to get a mammogram don't apply if there's something unusual happening, and your doctor will determine what the next step should be.
Yeah. And so, what are some of the most common types of breast conditions that women are diagnosed with that aren't cancerous?
Well, the probably one of the most common is called a fibroadenoma, and that's basically just a clump of glands and tissue in your breast. That's one of the most common causes for those sort of firm uh, lumps or bumps that feel like beans or grapes. It's funny how medicine always refers to food when it talks about things, but yeah, it feels something like that in there. Um, we all get those throughout the course of our lives. They usually start showing up when we're in our late teens, early 20s. They can come and go. They can be affected by where you are in your menstrual cycle. They can be affected by being pregnant or breastfeeding. They can be affected by your hormone levels. So whatever is happening with your estrogen levels, they can be affected by hormone replacement medications and some other medications. They tend to shrink down and be less prominent as we go through menopause and beyond, but they're there for throughout your life. The other common finding that we may think is cancer, but it turns out not to be, are cysts. You can get little fluid-filled sacs in your breast, and those also can show up anytime throughout the course of your life. They can come and go. They can get bigger, smaller. They can be affected by different things like where you are in your menstrual cycle. Uh, you don't do anything about either one of these problems. They are not cancerous at all. They don't increase your risk for getting cancer. And, once in a great while, a cyst might become so big or so uncomfortable that a doctor might recommend putting a needle in there to drain the fluid or, doing something to remove it. But usually they just come and go on their own and you really don't have to worry about it. But you do need to be familiar with the fact that you have those kinds of things in your breast, and you need to know what's normal for you, that you have one on this side up, near your collarbone, and another one on the other side. And when those things change, that's when you need to let your doctor know.
Yeah. So, that kind of goes right into the next question of like, what breast pain is considered normal and what is not?
Well, breast pain is one of the symptoms of cancer, but all of us have tender breasts at some point throughout the course of our lives. It's very common for us to have breast tenderness and even swelling during certain times of our menstrual cycle. That's why they recommend, if you're going to have a mammogram, to wait at least a week after the end of your period so that your breasts are less tender and less swollen. That's also the best time to do your monthly breast self-exam, when your breasts are not going to be tender and swollen. If you're pregnant, your breasts are going to be tender. You're going to have pain in your breasts. If you have just delivered a baby, you're going to have breast pain. If you're breastfeeding, you can have breast pain. There are certain medications that can cause us to have pain and swelling in our breasts, like hormone replacement therapy, some birth control pills, water pills, medications for blood pressure and heart disease, and even some mental health medications can cause us to have normal pain and even some swelling in our breasts. This can just fluctuate throughout the course of our lives. It responds to where your hormone levels are. The thing, like I said, to be familiar is to be familiar with what's normal breast pain for you. And if all of a sudden the pain that you're experiencing is in a different place than you're used to, or a different quality than you're used to, that's when you need to let your doctor know. Because yeah, breast pain can be a sign or a symptom of a possible breast cancer.
Yeah. And I know, breasts change a lot with pregnancy and everything. So, how do breasts change over a woman's lifespan?
Well, they do go through a lot of changes. Like I was saying, they're made up of fat and other tissues, and those glands and other tissues are really designed to help us produce and deliver milk. So if you are pregnant, or you just delivered, or you are breastfeeding, your breasts are obviously going to go through some serious changes because of the work that your breasts are doing to produce and deliver milk. Uh, as we get older, as we go through menopause and our hormone levels start to fluctuate, our breast can change size and shape, because we're no longer responding to those same levels of hormones. Just losing or gaining weight can cause your breast to change size and shape over time. And again, certain medications, certain hormones can affect how your breasts, the size, shape, how they feel, how lumpy or bumpy they are. Um, there are multiple factors that are going to affect what happens to your breasts, and they are going to change as we age.
Yeah, and does that also change the breast density? Because I've seen her mammograms of when they've discussed how breast density can kind of play into this.
Well, breast density basically means that of all the ingredients that give our breasts their size and shape and structure, we have people that have dense breasts have more of the glands and the ducts and the fibrous tissue and less of the fat that's in there. Now, that can increase your risk of getting breast cancer, but it doesn't mean that it increases your risk of dying from breast cancer. It just means that you have more of the stuff that those cancer cells can come from. Certain people are more susceptible to having dense breasts. For instance, Black women in general are more likely to have dense breasts compared to other races. During pregnancy, your breasts become denser than they were, before pregnancy. There are, again, certain medications like hormone replacement therapy that can cause you to have denser breasts. So, that just means that you have to be super in tune. If you've been told that you have dense breasts, you have to be really in tune with doing your regular exams and knowing what all of that feels like normally for you so that you can be aware when something new pops up. And it also means that you have to be very diligent with getting your mammograms. Dense breasts make it harder sometimes for mammograms to pick up on something that's unusual because everything that is not your regular breast tissue looks white on a mammogram, which is basically a type of X-ray, including the normal dense tissue, that are just clumps of glands and fibrous tissue in your breasts. So a lot of times women that have dense breasts might be told after they've had a mammogram that they need to come back and they need to have an additional test like an ultrasound done, just so that the radiologist can be 100% sure that what they're looking at is just normal dense breast tissue and not anything unusual. So that's just something to be aware of and to sort of be prepared for if you've been told that you have dense breasts.
That's good to know. So how does estrogen play a role in women's breast changes throughout her life?
How does what? I'm sorry?
Estrogen change a
Oh,
woman's
estrogen. Well, that's one of the hormones that your breasts are going to respond to. Your estrogen levels are going to change throughout the course of your life, and depending on what's happening at a particular time in your life, like where you are in your menstrual cycle, if you're pregnant, if you're breastfeeding, and because of that, your breasts are going to respond by producing more glands or ducts. They can become more swollen, more tender. That's part of why your breasts get that way during a certain part of your menstrual cycle. So it's just something to keep in mind. And the reason that estrogen is of special interest when it comes to breast cancer is because there are certain types of breast cancer that have receptors to estrogen so that you can actually use estrogen to treat that type of cancer. I don't know if you've ever heard of something called triple negative cancer. The way that I understand it is if you think about a cancer tumor like a house that has a door on it, and it has 3 locks on the door, and you want a key that's going to fit at least one of those locks so you can get in there and clean out that house and get rid of that cancer. Estrogen is one of the keys that can fit the lock on some types of cancer. And then triple negative cancer means they don't have those 3 locks. So it's harder to treat that type of cancer because you don't have any keys that fit those types of locks to get in there and clean it out.
Yeah, that's good to know. So then also, I know a lot of times for breast cancer, we always go back to it's about family history. Does your mom have it? Does any of
Mhm.
your sisters? So how close does family relations have an impact on your potential for having breast cancer? And how close family wise does it need to be? Grandma, aunts, how far in the family tree do we go back?
That's a great question, and there's a lot of confusion about that. So, first of all, it's important to understand that 85 to 90% of breast cancer cases happen in people who have no family history whatsoever of breast cancer. So, that's the majority of breast cancer. They have no relatives at all who have ever had it. But there is a percentage of people that are considered high risk for having breast cancer because they had a first degree relative with breast cancer. So, what does a first degree relative mean? It means your mother, your sister, or your daughter. So, if any of those folks have had breast cancer, that raises your risk really high that you might get it as well. Um, Now, also, it does extend to second degree relatives, which are, cousins, aunts, grandparents. If you have more than three relatives in that area who have had breast cancer or ovarian cancer, that can increase your risk of getting breast cancer. And it doesn't matter if they're on your mother's side or your father's side for that second layer of risk from getting it because your family has it. Another area of risk is if you carry an inherited genetic mutation. And you may have heard of the BRCA gene or the BRCA. There's BRCA1 and BRCA2. These are gene mutations that are inherited. So that's another way that you can, because of your family history, have a higher risk of getting breast cancer. But like I said at the beginning, most people don't have any family history. And, that can kind of make people neglect taking care of their breast health because they think, well, nobody in my family has it, so I don't have to worry about it. And that's just not true.
Yeah. And so if you want to get that genetic testing, you just kind of bring that up to your doctor of you're interested in doing it, or do you need to have that family connection?
It's best to talk with your doctor about it. Your doctor will be able to determine what your risk is and if it's necessary to do that testing based on your family history. So if you think you have a family history that puts you at high risk, it's important to talk with your doctor about that. Another thing that I recommend to people is there's this great tool online. It's called the Breast Cancer Risk Assessment Tool. It's at the National Cancer Institute website. And it basically asks you a bunch of questions about your family history and about your own health. And it spits out at the end what your risk is for getting breast cancer. And it compares your risk to what the overall risk is for the average woman in the United States. So that's a good way to kind of help alleviate your fears if you're, worried about it. And if you did that tool and it showed that your risk was really high and this was not something you discussed before with your doctor, then that would be a good reason to get in touch with them and say, hey, I did this tool online and it says I have a high risk. What should I do next? And that's when your doctor might talk with you about getting that genetic test or doing other things to make sure that we can, prevent you from having breast cancer that's not detected.
Yeah. And what other ways might boost your chance or your risk of getting breast cancer?
Well, there are some things that we can control and some things that we can't. Now, among the things that we can't control are obviously our genetics and our family history. If you have had breast cancer before, your risk of getting it again is higher. If you've ever had any type of radiation because of any type of cancer before, especially if that radiation was to your chest, like, in childhood lymphomas, sometimes they get radiation therapy as a child, that can increase your risk. If you have never had children, or if you have children at a late age, like you have your first child after the age of 30, that increases your risk. if you had your period at an early age, before the age of 12, or if you have your menopause at a late age, like after the age of 55, those are things that you can't control, but they increase your risk of getting breast cancer. Basically, the two most important risk factors are things that we can't control. First of all, being a woman and having breasts is a risk factor. And the second is getting older. Your risk goes up as you get older, and it's really pronounced between the ages of 40 and 75. Your risk is going to continue to go up during that age range. It will start to plateau after 75, but it never goes away. So like I said at the beginning, if you have breasts, you have a risk for getting breast cancer, and that's just something that we have to live with and deal with. You can now the things that you can control that can increase your risk for breast cancer are, first of all, being overweight, being obese. The higher your weight, the more your risk for getting breast cancer. Another thing is not being physically active. If you are not exercising in some way, shape, or form regularly, that has been shown to increase your risk of getting breast cancer. Also, your diet. If you're eating a lot of processed foods, high salt foods, red meat, high fat foods, that increases your risk for getting breast cancer. Another thing that you can control is your alcohol intake. They've shown that if you have more than just a couple of drinks a day, that definitely increases your risk for getting breast cancer. Smoking is another risk factor that you can control. That if you avoid that, you can avoid getting breast cancer. Those are the main things. Now, there's some things that are sort of in the gray area, like breastfeeding. Definitely breastfeeding decreases your risk of getting breast cancer. Now, is that something you can control? Sometimes not necessarily. Maybe you tried to breastfeed and you couldn't, but it is something that can lower your risk. Also, taking hormone replacement therapy or birth control pills. When you take those types of medications, that increases your risk of getting breast cancer. Now, is that something you can control? It depends. It depends on what alternatives you have. But those are the main things that stand out as primary risk factors, both the ones we can control and the ones that we can't.
You can't choose to have your breasts or not have them. You can't choose your family, but at least you can choose to have a healthy life.
Right, exactly.
So what
Exactly.
symptoms should we be aware of, cancer-wise, of looking? Is it physical, not only just the feeling of a of a lump, but is there anything else physically that we can notice that might be a trigger of a change?
Yes. So when you do your breast self-exam, like I said, you want to be familiar with your neighborhoods. You want to know, what does it look like? So if you see some sort of strange skin changes on your breast, like redness or dimpling or flakiness or thickness of the skin, those are all signs of a possible breast cancer. Also, pain, like we talked about before. If you have unusual pain or soreness in your breast that you're not used to having, that could be a sign of breast cancer. Also, just looking at the size and shape of your breast. All of us have breasts that are asymmetrical. Nobody has exactly matching breasts. But if you see something that is really standing out as being different between the two in terms of their size or their shape, that could be a sign that something is going on. Also, the lumps and the bumps, like we talked about. If you find something new that you're not used to feeling, that could be a sign. If something that you're used to feeling suddenly is different, it's gotten bigger or more painful, or anything out of what you're used to feeling, that could be a sign. So those are the main things.
Yeah, and so we talked about getting to know your girls and and we talked also about the importance of doing a self exam, but how often should we be doing them, and what is the best or proper way to do one?
Well, it's important for us to start as soon as we really start having breasts, like in our teen years and our early 20s, to do a breast self-exam at least once a month. And like I said, the best time to do it is the week after your period has ended, because then your breasts aren't going to be swollen and tender. It should just become a regular appointment with yourself. And you should also, besides doing your breast self-exam once a month, you should be getting a breast exam done by your physician at least once a year at your annual physical. So the best way to do it, I just happen to have a handy dandy model here to help go through this.
Perfect.
You want to start by just looking at your breasts. So you want to sit in front of a mirror just with your arms at your side, and you want to look at the breast to see, like I was talking about, the size and the shape of your breast. Is there anything that really stands out as being different about how they look? You want to also, something I forgot to mention, is look at the nipples. Is there any type of discharge from the nipples? That can be another sign that there could be breast cancer or something going on. If you're breastfeeding, obviously that's going to be normal, but if you're not and you're seeing something coming out of your nipples, that could be a sign of a problem. After you just sit there and look at your breasts and make sure everything looks okay and the skin looks okay and everything, you want to raise your arms up in the air while you're still looking at your breasts, because that motion can sometimes show some sort of skin change or something else that you didn't see when you're just sitting there with your arms at your side. You want to do the same thing by putting your hands on your hips while you're sitting and looking at your breasts in the mirror, and see if that causes any kind of weird changes, like a dimpling in your breasts, or something that stands out as the shape or the size looking very different from each other. The next step is to lay down, and you want to lay with your arm behind your head. And you want to take the 3 fingers of your, so if I'm going to start by looking at my, examining my left breast, I'm going to put my left arm behind my head, and then I'm going to take the 3 fingers on my right hand, and I'm going to start going in a circular motion around all the neighborhoods of my breast. Now, when I talk about neighborhoods, it's not just the breast itself. You want to go all the way up to your collarbone, and you want to go down into your armpit on that side. All of that is part of the neighborhood of your breast. You want to go around in a circular motion with those 3 fingers, and you want to really feel down in there and feel, you're going to probably feel some lumps and bumps, but does it hurt? Does it feel weird? Did I notice this in this place last month when I did my exam? Do I have the same lump in the same place on the other side when I go to it? Those are all the questions you need to ask yourself while you're doing this. You also want to go right to the nipple, and you want to feel that tissue underneath the nipple also. Move your fingers around, make sure you don't feel anything unusual, nothing that is painful. And then once you feel like you've gotten all the neighborhoods covered, the collarbone, the breast itself, the nipple area, the underarm on the left side, you're going to do the same thing on the other side.
Well, I think I was doing that one wrong, so this was good to know. So thank you for that demonstration. So
Sure.
do we, before we kind of jump into questions, do you have anything else that you'd like to cover before we see if anybody has anything that I missed?
I would like to talk a little bit about some of the things that we can control as far as risk factors. What can we do to control those things that we can control? So one of those is to exercise regularly, because not moving around is a risk factor for breast cancer. And the studies show that you don't have to go out and run a marathon. You don't have to do extreme sports. All they need you to do is walk 30 minutes every day, just 30 minutes a day. And the tests even show that you can break that up into 10-minute walks. So if you walk for 10 minutes 3 times a day at a moderate pace, that is enough to decrease your risk of getting breast cancer. The other thing is to pay really close attention to your diet and start adding some things that maybe you don't have in your diet currently. There are many foods that they call cancer superfoods, because they actually have nutrients in them that kill cancer cells. So some of those cancer-fighting superfoods are things like veggies, especially broccoli, cauliflower, and Brussels sprouts. These are fantastic cancer killers. Also, berries, any type of berries, strawberries, blueberries, blackberries, they have antioxidants and they have free radicals uh, that are cancer fighting free radical killers. Um, Making sure that you know, if you're, especially if you're trying to lose weight, which is another way to decrease your risk, looking at a Mediterranean diet. The olive oil and the nuts in that diet, especially, are cancer killers. Making sure that you avoid those processed and high fat foods. The other thing is, you don't have to stop drinking alcohol, but you want to do it in moderation. They have shown that you can have a couple of drinks a day with no problem. But once you get past a couple of drinks a day, that's when your risk goes way up for getting breast cancer. So, another thing is to just have a healthy environment. I read a really interesting study that having houseplants can help decrease your risk of getting breast cancer because they remove toxins from the air. So I think it's all about taking care of yourself, you know, by doing your breast self exams and by following a good healthy diet, adding some of these healthy foods, getting out and doing some walking or some exercise. It's about self-care. And when you do that, you're taking care of yourself and you're taking care of the people that you love. I've read some interesting studies that show a lot of women, especially Black women, are reluctant to get their mammogram because they're worried about what if something is found on there and they are found to have breast cancer. They don't want to be a burden to their families and their loved ones. But really, if you don't take care of yourself and you don't get these things done, by the time if you do have breast cancer, it's found, it's beyond the point where it's easy to treat and easy to cure. So by taking care of yourself and taking care of that preventative care, you are taking care of the people that you love. So that I'll get off my box now, but I wanted to get that across.
Well, yeah, and that's very important since we all know women really struggle with taking that time for ourselves since we're always used to taking care of other people and looking out that we really need to retrain ourselves to make sure to take care of ourselves. And now I'm going to be making a giant berry smoothie with broccoli. So now I've changed my diet.
Right.
So we had one question come in. Can a benign lump turn into cancer?
It depends on what that benign lump is. Now, I mentioned earlier something called ductal carcinoma in situ. Some people call that stage 0 cancer. Some people say that's not truly cancer. That is something, though, that can turn into cancer if it's, you know, even though it's detected very early and very small. It's not something, you know, that is 100% benign. The other things that I mentioned that we commonly find that, you know, seem like they might be cancer until we do our tests and our investigation, the fibroadenomas and the cysts, those do not turn into cancer. So it all depends on what it is when we're talking about the lumps and the bumps.
Okay. And the other one was, are there any risks involved with the cancer screening?
So, you know, a lot of people are reluctant to get a mammogram because they're worried about the radiation. But the fact is, the amount of radiation you get in a mammogram is the same that you would be exposed to if you took a nice flight from Houston, Texas to Paris, France, and back. The other way to look at it is it would take 100 mammograms to get the same amount of radiation that you get when you get one CAT scan. So that fear about the amount of radiation is not founded, and there's not risk, you know, of radiation exposure just from getting the mammogram itself. Probably the biggest risk from getting the mammogram is that they find something that is suspicious and then they call you back to do some additional testing. And the risk there is that it creates anxiety. And I think that's why a lot of women avoid getting it in the first place because they just don't want to go through that. They don't want to find out any bad news or anything that could make them worried or afraid. But, you know, 90% of the time, these mammograms are going to be normal. And even if they do find something that they're kind of suspicious about or they can't see very well and they ask you to come back and do some additional tests, most of the time, those additional tests show definitively it's not anything that's cancerous or anything to worry about. So I think that, the biggest risk is just the fear that it can create.
Yeah, I agree. Because my mom's best friend was very scared about hers, and she had a false positive on her mammogram. And she was like,
Hmm.
I'm not doing it again. It's like, no, but
No, that's all the more reason to
all
keep doing it,
exactly,
right?
exactly. Well, I want to thank you. Is there anything else you'd like to share? I think that's all the questions we had come in. Is there anything else?
No, I think that's it. I've enjoyed talking about this, and I hope that this has been helpful for a lot of people. And I also hope to see you at the Mammorama on Friday.
Yes, everybody, please come onto the Mamorama. We were going to have the Mammo van truck out. We'll also have other vendors providing resources and services that keep you healthy and happy. As we see, we have to take the time to take care of ourselves.
Right. We're going to be having vision exams. You can get a COVID test. We'll be giving out flu shots and COVID shots, and we'll be talking about wellness and health.
Yep, and that's at the MLK Junior Center off of MLK and Cary from 8 a.m. to 4 p.m. All right. Well, thank you, Dr. Thompson. It was great talking to you, and I learned a lot today, and I hope everyone else did as well. Thank you so much.
Great. Thanks for having me. Take care.
Take care. Bye-bye.